Post-Cancer Treatment Follow-Up Gap, presented by Dr. Jacob Swilling, Ph.D. Know Your Options Wellness Center. Failure of Oncology. This presentation is in response to the increasing numbers of published articles reporting the failure of oncology to offer follow-up support service after patients have been released from chemotherapy, radiation, and surgery programs. Long-term development. In proper perspective, most cancer is known to have developed over many years, 7 to 20 years, up to the time of the diagnosis. During this time, the development of the cancer has been draining the patient's resources, weakening the immune system, releasing abnormal amounts of stress hormones, and record a variety of worsening side effects leading to the diagnosis as well as a serious drain on finances. The stress endured by family, friends, and job relations is devastating to normal life experience. Cut, burn, and poison. Most of these patients are diagnosed at a time when their health is so compromised as to be unable to repair and heal. The devastating action from our oncology system is the imposition we are all familiar with, that is the cut, burn, and poison approach at the very time when the body is unable to respond. Predictable side effects. The predictable side effect of the diagnosis familiar to most patients include nausea, hair loss, emotional and mental despair, and a miserable experience requiring frequent tests to monitor the immune system, blood chemistry, and biological functions. In this regard, it is predictable to expect being medicated to cope with the side effects of the treatment during and following the treatment after completing hospital care. Intimidation. Most patients are led to believe that this experience described above is the only way to treat cancer. The intimidation includes the need for urgent action. Reports from patients who have been told that if they do not take urgent action, their life expectancy is limited to a few months. Let's examine the above scenario. 1. Cancer is not an infectious or communicable disease. Cancer is the development of factors including poor nutrition. Poor nutrition means processed food, fast food choices, chemicals added to food such as preservatives, artificial coloring, sweeteners, and many toxic chemicals polluting our food. Stress. 2. Stress in its many forms. These include abusive or stressful unhappy relationships, stressful work environment, and frustration that occur in the daily routine of life experience. Accumulative toxic overload. 3. Exposure to environmental pollution including household chemicals, garden and chemical vapor such as formaldehyde from carpets, upholstery, and so on. I refer to these factors described in my books as a cumulative toxic overload. The mental and emotional challenges of many kinds. 4. The question that should be with all of us is, where is the logic or scientific basis for oncology treatment of cancer when the body is desperately working to deal with a toxic overload? Where is the logic or scientific validation of the side effects of chemo, radiation, and surgery? It may surprise our group that there is not one study that has proved chemo cures cancer. Helping the body heal itself. The answer to the above question focuses attention to the obvious answer, which is to apply all our scientific knowledge and experience to help the body to heal itself. All our experience in this direction emphasizes that the body has an amazing potential to heal itself, given the proper support to reverse the years of accumulating toxic overload. Future direction for cancer. The success of KYO is the combination of several different therapies administered in one space to effectively help the body to heal itself in the shortest possible time. This proven success is to be the direction for cancer cures in the future. Multifaceted follow-up. So, at this point, how do we fill the no follow-up gap after chemo, radiation, and surgery? Clearly, follow-up needs to be a multifaceted support system. This requires a self-help support program addressing all of the overload problems described above to maximize potential healing. More enlightened cancer patients. Our experience is there is an increasing number of more enlightened cancer population able to comprehend the potential of the body to heal itself. Best results begin with an intensive treatment over a period of 1 to 3 weeks, all day Monday to Friday from 8:30 to 4:30 to initiate the self-help post-chemo healing process. During this process, each patient also benefits from coaching regarding the implementation of a self-help program. One-Stop Wellness. What follows is an explanation of our One-Stop Wellness program, ranging from special tests including thermal imaging, live blood cell analysis, special lab testing to evaluate immune function, toxic metal overload testing, as well as description of specialized therapies used to detoxify, including colon cleansing, ozone and oxygen therapies, IV nutrition, and much more. Thank you. Contact us with questions. KnowYourOptionsWellness@gmail.com. Know Your Options Wellness Center. This program is exclusive to Know Your Options Wellness Center. Copyright by researcher Jacob Swilling, PhD. For more information, visit KnowYourOptionsWellnessCenter.com.